Hello again, hope everybody's doing well. This is going to be my last little session. We're going to talk a little bit about the double mastectomy. We're going to call it prophylactic mastectomy, meaning that there's nothing wrong with the breast, but we're going to take the breast off for prevention. So this can be a very emotional discussion. There's been a big trend in the last decade or so in this country to proceeding with prophylactic mastectomies or double mastectomies. We really have to weigh the advantages and the disadvantages with doing that. We know that the reason women have really pushed this, and this has really been driven by the patient, is because of, number one, their fear of developing another breast cancer on the other side. And number two, their desire for symmetry. They want the two sides to look similar. So there's been a lot of advances with plastic surgery and reconstruction. So the reconstruction is better. And if we can save the nipple, the reconstructed breast looks good. It doesn't have the sensation of a regular breast, but appearance-wise, it looks very good. So we have fear that's driving patients, and we have the desire for symmetry. But what we need to talk about is what really is the risk of developing another breast cancer in the future. And for most patients, it's not very high. Now, it's different if you have what's called a genetic mutation, if you have an abnormality in your blood that makes you more, or in your DNA, excuse me, that makes you more likely to develop cancers. Then yes, there's a role for doing a prophylactic or a double mastectomy. But most patients don't have mutations. So we have to look at what is the real risk of them developing cancer. And this is something that your surgeon can talk to you about. Most patients are going to be placed on a pill, an anti-hormone pill that's going to help treat the cancer they have. That also will prevent cancer in the other breast. So we have to look at the pros and the cons. And it's important to realize that the risk of complications, if you do a mastectomy, a double mastectomy, and that other breast does not have cancer, the risk of the complications doubles. The other thing is you're losing sensation. So if the breasts are important from a sexual standpoint, there's no sensation. Even if we do these nipple-sparing mastectomies, they look good, but the sensation is not there. So you've got to look at the actual risk of developing a cancer in the future, and you've got to look at increased risk of complications. So the patients that this is usually recommended for are patients that do have genetic mutations, the BRCA mutations, or patients that are younger with an early stage cancer. Those are the ones that are going to have the most benefit. The older patients, there's not that benefit. So these are all things that really need to be considered again and talk to your surgeon about. So thank you for allowing me to discuss some important topics. And as I end, I just want to ask everyone to please, this is an important election year. I know I probably shouldn't be political here, but please go out and vote. Hopefully you're registered. If you're going to do mail-in, please do it early. There are very, very important decisions that will be made in our country in the next 4 years. So thank you very much.